Nursing in the UK is completely different from nursing in the USA. From the uniforms to the way we practice to the pay, which can almost double in the US compared to that of the UK. There are some huge differences, and let's break it all down today. I have been getting these questions, but this is the time I'm most comfortable to answer those questions. I have been privileged to work as a nurse in both countries, both the UK and the USA, and honestly, the differences surprised me. This video isn't about saying nursing in one country is better than nursing in the other country. Both systems have their strengths, they have their challenges. My goal is to share what I have experienced firsthand so that if you're thinking of relocating, you would know what to expect. I have so many nurses in the UK who are waiting for retrogression to be over and they want to move to the USA. Hi everyone, welcome and welcome back to my channel. My name is Ucheago, and on this channel I share information that help nurses. I share information that could help people relocate or study abroad, and career tips. If any of this interests you, please do consider to like this video and subscribe to the channel. I just want to share what I have seen firsthand along with some research. So if you're a nurse planning to relocate, you would have a clearer picture of what to expect. So let's dive right into it. And the first difference is something you will notice right away: the way we call medications. The way the UK calls medication is different from the way the US calls medication. These are the same thing. It's just that the UK calls by generic name, the US calls by brand name. So we're going to start with medication names because that was my very first shock. In the UK, medications are called by generic names. For example, popular medication that is used for nausea, vomiting on Dansetron, that is called, the US calls it Zofran. Popular blood thinner used in the UK is called enoxaparin, the US calls it Lovenox. The UK calls a pain medication hydromorphone, the US calls it Dilaudid. The UK calls paracetamol or Calpol, the US calls it Tylenol. Fun fact, morphine is still called morphine in both countries, and adrenaline is still called adrenaline in both countries. Now let's talk about controlled medications. In the UK, nurses have to do a controlled drug count at the start of their shifts and at the end of their shifts. Bear in mind that this might be different from the wards or the floor. I worked in the ER in the UK, and for every shift we have to do a controlled drug check at the start and at the end of the shift. In the USA, controlled medications are stored in the Omnicell or Pyxis, and you would only require a witness when you're wasting a partial dose. So let's say you want to pull Dilaudid and the provider prescribed 0.5 milligram. You would need a witness to waste the other 0.5, if that makes sense. Still on the medication, let's talk about the medication administration system. The USA, in every patient's room, there is a computer and there's a scanner. So you scan the patient and then you scan the medication before giving it. This helps to reduce medication error, because if you scan the right patient with the wrong medication, it's going to flag, or you scan the right medication and scan the wrong patient, it will pull out, it's going to flag it. The UK uses electronic medical records, but barcode scanning is not a universal thing there. Fourth point would be communication with doctors or providers. In the UK, you have doctors like on the floor in the ED, you have physician assistants. If you require them, you can literally see them passing around, same as the US. However, if you're working on the floor and you need to call a provider, you have to call their phone or get their supervisor to reach out to them. In the US, you can also call the provider if you're on the floor for urgent needs. But most facilities would have an app that you can text the providers for non-urgent needs. Like if you feel like it can take a minute or two, you can always text them. Let's talk about vital signs. Practicing as a nurse in Nigeria and the UK, you are required to go around patient rooms and then write down the vital signs. However, in the USA, if a patient is on a bedside cardiac monitor, all the vital signs are saved under their name. You literally just go to the electronic record on the computer and pull those vital signs. Even temperatures, if they have a temp sense Foley catheter. However, if they don't have a temp sense Foley, then you need to get the temperature manually. In the UK, most vital signs, they are manually written or entered by nurses or healthcare assistants. Point number 6, let's talk about the nursing assistants and the staffing ratio. The UK often has one nursing assistant to each nurse, but shortages could be common, okay? But the USA, ratios vary. You may have more support staff depending on your floor. On the floor, you can have nursing assistants, you can have a tech, you can have a unit secretary, you can have a paramedic on the floor. In the emergency room, you might have 2 to 3 nursing assistants on the entire floor. Point number 7, the trainings and sign-offs. The UK, even if you're an experienced registered nurse, you have to be signed off by another nurse for basic skills. When I mean basic skills like giving oral medications or giving intravenous medications. This is especially when you get into a new job. Now, in the USA, once you are licensed, you don't need that level of sign-off. You would have a preceptor for orientation period, but again, independence comes real fast. I remember one time in the UK, the provider wanted me to give an IV medication to a patient in resource, but I'm not signed off. Typically, I am not covered to give that medication. I couldn't give that medication because the hospital policy is that you must be signed off before you can administer any medication. And the scare of your PIN, that of your PIN, and all of that. I told my colleague to give this medication. Rather, she wasn't done with her patient. The provider was upset with me and, said some words that didn't sit well with me for the rest of that shift. But this is not a thing in the USA. Now let's talk about uniforms. Uniforms in the UK are color-coded scrubs depending on your band. If you're a band 5, sky blue for band 5 staff nurse, or navy blue for band 6, band 7, band 8. But the USA, where I currently work, you have freedom to wear any color of scrub, any work shoes, as long as you have your identification or badge on you at all times. That is their way to go. Let's talk about teamwork and support as my point number 9. In the UK, teamwork exists for sure, but you're often expected to complete your own medication rounds even if you're struggling. In the USA, teamwork is something I have seen, I cherish, and I have experienced. It is very visible. If a new patient comes in, for example, I receive a new patient and I am still busy with another patient, my colleagues are going to step up to help stabilize that patient even before returning to their duties. The charge nurse is not just going to ask you, do you need help? They are going to offer you help and support. This is one of the things that I appreciate here. Point number 10, patient rooms. In the UK, some of their wards are shared wards. Shared wards are common. In the USA, most of the rooms are private rooms, which involves, privacy, workflow, and, confidentiality when you're discussing a patient's disease condition with them or prognosis. Point number 11, healthcare costs. In the UK, healthcare is generally free at some point of use through funded taxes. The USA, on the other hand, healthcare can be expensive without any insurance. The next point is what interests and excites everyone. Let's talk about the salaries. In the UK, the average salary for nurses is about £33,000, which is roughly about 45,000 US dollars. In the US, your average salary ranges between 75,000 to 86,000 USD, depending on the states, depending on your specialty, depending on your years of experience. Point number 13 is advanced practice. The UK, nurse practitioners exist, but prescribing rights are tightly regulated. Even the physician assistants, they cannot prescribe medications in the UK. The USA, nurse practitioners can diagnose, prescribe, and even practice independently in many states. Physician assistants in the USA can prescribe medications here. Point number 14, let us talk about professional practice and accountability. In the UK, you often hear the warning like, be careful, you could lose your PIN or your NMC license. There's always this threat surrounding your PIN. And this creates often like a culture of fear around especially international nurses. In the USA, the focus is more on common sense and accountability. You are trusted to work within the standards of practice, and of course, to protect your license while delivering safe and effective care. I have never heard about you know what I mean. Point number 15, let us talk about maternity leave. This is another one that people always like to talk about and use against the US. I understand their point. You would often hear nurses say they want to have all their children in the UK before they relocate to the USA. The reason is not far-fetched. In the UK, you get 9 months paid maternity leave and you can decide to stay up to 1 year at home. However, in the USA, you would have 12 weeks maternity leave. This could be paid or unpaid, depending on if you're a permanent staff or a part-time staff. Another significant thing I really like working in the USA is that where I currently work, we have respiratory therapists, and they are in charge of the BiPAP, the ventilator settings, and all of that. In the UK, you as a nurse working in the ER, you were responsible for those equipments, and if you had moderate sedation, you're also responsible for monitoring the airway, and also checking the vitals and all of that. I like that there is a specialist involved to monitor patients' airway in situations like this in the USA. And additionally, in the UK, when you work in ED
I don't know about the other units, but in the ED, you're expected to do checks like all the code cards, your stockings, your drawer. You're responsible for doing it and signing for it. Here in the USA, the cards that we check and just restock is basically the cards in patient rooms. The ones involved with code cards, we don't restock it. We know what is stocked in it, like layer by layer. It's color coded. Once you have a code and you use that card is taken by pharmacy and restocked and returned to you.
Additionally, in the US, some things are called differently. Some things that we regularly use as nurses. I'll give you a few examples. When I came here, they call incontinence pads, they call it chalk pads. So when I heard chalk pads, I didn't know what that was, so I had to ask. And when they showed me, I said, we call it incontinence pads. Some places in the UK will call it Inco pads. In Nigeria, they call it Nightingale. I'll put that on the screen for more context. Another point is, in the UK, they called trolleys. The US calls it carts, code carts, but UK calls it trolleys, like where you move around. I'll put a picture as well. You know the room we keep, or dirty linens are kept. The US, they call it like dirty linen room. Nigeria, UK, they call it sleeves room.
I also had someone ask me if we carry out perineal care in the USA as nurses. The answer is yes. I haven't seen anywhere nurses do not carry out perineal care. If you have seen or experienced it, please put that in the comment section. Bear in mind that you also have nursing assistants. They call them certified nurse assistants here, and that is one of the things they do. But generally, if they are not there, even if they are there, you can still do it. I don't see anything wrong in it, and I don't find it irritating. It's part of the job.
Another point is, in the UK, if you're not in the managerial role where you do just Monday to Friday or Monday to Thursday 9 to 5 a.m., you get to rotate all the shifts: morning, evening, that's morning, night, and sometimes mid shift if your hospital does mid shift. On exceptions, you can just do day shifts or just do night shifts. That is, you meeting your manager, you have a complaint or you have a pressing need and they place you in a particular shift. However, in the USA, shift variations, you are either doing only morning shifts or you're doing night shifts. But that is for the floors mainly. In the ER, you have ability to choose working 7 a.m. to 7 p.m. or 8 a.m. to 8 p.m., 9 to 9, 10 to 10, 11 to 11, 12 to 12, or 3 to 3. So, or you're doing night. This is just to spread out the shifts.
Finally, with these few points of mine, every country has its own challenges. Every country has its own benefits. So find you the one that you deserve, or the one that you admire, or the one that you're comfortable with for you and your family. And that's it, guys. If you found this video valuable, again, please like this video, drop a comment if I missed anyone, and kindly subscribe to the channel. At the end of the day, nursing is beautiful in both countries. I have had unique experiences and I have learned so much from both systems. Wherever you practice, what matters the most is giving the best possible care to your patients, right? And if you've worked as a nurse in the UK and you move to the USA, you are going to have an edge because you're coming in knowledgeable, unlike if you've come from, a third world country that things are not really developed. That's it, guys. Thank you so much for watching this video. I hope you love this video as much as I put in the effort to make this video, and I will see you in my next video. Thank you for watching, and I will see you again. Bye for now.